Precision Surgery Clinic. Surgeons you can trust.
Hi, my name is Samuel George. I'm a consultant plastic surgeon and the lead surgeon here in the Precision Surgery Clinic. Now, I want to talk to you a little bit about the pinnaplasty procedure or prominent ear correction that we do. Now, the two reasons people have prominent ears are, firstly, this fold, the antihelical fold, which is a fold inside your ear, is not formed, and that causes the ear to stick out a little bit. The other thing that can happen is that the conchal bowl, or the bit inside your ear, is developed too much, and it also can cause your ear to stick out a little bit. What we do when we do the procedure is we recreate the fold, the antihelical fold, and we also set the whole ear back to give you a more natural appearance. Now, there's a fine balance between the two. We don't want to put your ear back too far, that just looks a bit odd. So we just try and make it a little bit normal by putting the ear back slightly into a more natural position. Now, there's two techniques that are mainly used for this. One technique is to make an incision behind the ear, cut the cartilage and go to the front of the ear and take all the skin off the front of the ear and score the cartilage to allow it to curl back naturally. I don't do this technique. The other technique that I do is to remove a little bit of skin from the back, go in, dissect the tissue out, go to the cartilage at the back, and then use permanent sutures to actually recreate the folds and set the ear back. I feel this technique is less traumatic and there are less complications with this technique, and I'm also quite familiar with it and have had quite good outcomes with it. So this is what we do. The second thing that you need to think about is the dressings that you go home with. Now, traditionally, people have a big headband as a dressing. What I do is I just glue the ear back to the mastoid, which is the hard part of your head there. And that way, the glue actually becomes waterproof in 48 hours, keeps your ear in a good position, although it might look odd for a week or two until the glue dissolves and your ear comes back out again. But essentially, you don't have a dressing. So if you're a girl and you have long hair, actually everything's covered and no one knows that you've had a procedure. The other thing that you need to think about is sports. So I would avoid any contact sports for a good 3 months. Although the sutures are there to recreate the fold and put your ear back, and your skin wound actually heals in a couple of weeks' time. The cartilage doesn't actually scar into position for a good 2 to 3 months. So I would really take it easy for 2 to 3 months and avoid any sports, contact sports, dancing, anything that would risk something ripping your ear forward. We do supply you with a headband, and the headband should be worn at night every day for 3 months. And this is also to avoid the ear coming forward when you turn in bed.
Precision Surgery Clinic. Surgeons you can trust.